Hi friends, we are in Rishikesh right now, Rishikesh, India, and we came for a past life regression teacher training therapy course. It was a 7 days course, and we went through a lot of experiences that we never had in life, and we wanted to share those experiences and insight that came to it. And we are today with a very renowned past life regression therapist and clinical psychologist, Dr. Trupti Jayin. So I would like to introduce. Thank you, ma'am. Thank you for giving us this opportunity to talk in YouTube. Um, I come from a medical background. I'm an MD working in internal medicine as a hospitalist in the US. And I was telling about this to my friends, lots of friends, and they were kind of surprised that someone with a medical degree and everything. The first thing was, do you believe in all this? So, ma'am, what has been your experience with uh, people who are highly intellectual and do not want, not necessarily for their past life regression, but just to introduce to that kind of intellectual community? What tools or what way do you think is the best to get this there?
So, Saurav, because I've been working in a medical facility, like a mental health nursing home, for nearly 25 years, 30 years, I meet medical practitioners all the time, right? Psychiatrists, basically, who are medically oriented. So, psychotropic medication and stuff like that. But when they realize that they are at their wits' end sometimes with the patient, because the patient is not getting better, they're giving anti-anxiety, antidepressants. It's going on for 6 months, 1 year, 2 years, and the patient's symptoms keep coming back. When they are at their wits' end, they don't know what to do. Only because we are not studying the mind, we're studying the body, and we're studying the brain as a organ which produces certain chemicals. But is the mind chemically oriented? No. The mind is so subtle, limitless, whereas the brain is limitless only if you allow the cells of the brain to increase their electric potential to a level where you become a genius. But how many geniuses are there for that matter? So I always tell my doctor friends that the organ, the brain, is an amplifier. It amplifies things which are stored. But where is the storage? Storage house is not in the brain, it's in the mind. And the mind is immeasurable. There is no instrument that can measure the mind. The only thing I'm aware of is maybe a brain waves, like the EEG, okay, where we can come to know whether you are awake or you are about to sleep or you are sleeping. Apart from that, how do you tap the infinite potential of the mind? So I think the medical community needs to wake up a little bit to understand that it's important to go beyond just chemicals. Because I think if that happens, the infinite potential of the mind can be tapped by the medical community, as we are aware of hypnosis. So I'm sure medical fraternity is aware of hypnosis. And hypnosis is a recognized modality, especially in UK, US. Why have they recognized it? Because they know that in hypnosis, the client can access memories which are lost, which are forgotten.
Yes.
And for me, as a past life regression therapist, memories which are hidden, I don't know whether they are there, not there. But why not probe deeper, is what I'm telling the medical community. And I can tell you that psychiatrists with whom I work as a clinical psychologist, where I used to do psychometric tests and the Rorschach, the MMPI, and all these tests, today they refer their clients to me, and they say, "Trupti, I think we need somebody like you."
So we feel hypnosis could be a way to the further like past life regression.
Yeah, I think hypnosis is a great modality. It can be used ethically and well, and certain memories which are deep down, you can regress the client to those memories in the current lifetime, let us say, okay, childhood, in the womb, and many issues can be solved there itself. If the medical doctor doesn't believe in past lives, it's okay, it doesn't matter. But you can still use hypnosis for regression, regressing the client to an earlier memory, which is actually the cause of the problem, let's say. So I would say let's be open to that. And if the client moves deeper and accesses those hidden memories, maybe you need to be trained to understand how to process those hidden memories, how to allow them to come out, how to integrate and transform those memories so the client lives better. What is the purpose of medicine?
Cure, health.
To cure, to help, to have a better life. If this is giving them a better life, I think you should use it.
Yes, I agree. And I'm also part of a spiritual community. I've been for many, many years. And in that community, we always say it's your mind playing tricks. If, if a Christian is into like church and Christ and everything, in his vision he will see Christ. He will not see Shiva or Ganesh. And same way, someone who is a Shiva devotee is bound to see Shiva in his vision or in even real, so we say, okay, why not seeing others? So we feel like, okay, this thing is all imagination. How do you think for someone who is spiritual, like I'm part of a community in Nepal who they live there, they meditate there every day for years and years and years. Do you think first it is important for them to have a past life regression? And if you think there is a need, then how do we introduce that? Like how do we break that conditioning that it's not mind playing tricks?
So, like you said, that people who believe in Shiva will see Shiva, people who believe in Christ will see Christ.
Yes.
One God, one path is actually religion. It's not spirituality. Spirituality is all encompassing, everything. I've had patients who are Christians who see Krishna. I've had Christians who see, I have Hindus who see Christ. So why? Why are they doing that? And they themselves are surprised sometimes. Muslims who come to see me, they may have not told their family that they are coming to see me, but when they come and they see Christ or they see Krishna or they see Shiva, how do you explain that?
Yes.
So, because a spiritual being does not have boundaries or limits. You know? A spirit is what? A spirit is not a body. A spirit is everywhere. So why can't a spirit see he's following a religion? Because he's born in that family, right? But his spirit has experienced so many lifetimes, so many memories. Why can't he see Krishna or Christ or Allah? He can see anybody. So I think people who, what you're talking about is belief, right? So I believe that Shiva is the only um, God. And there's nobody else except Shiva. That is a very fundamentalist attitude.
Or some guru, let's say, like
Or some guru, yeah, you following a guru, you feel that is it.
yes.
Then you belong to a community. You belong to a
Organized.
ideology that the guru is preaching. That's all about preaching. That is dividing our world. I don't think that is the right way or the ethical way of living a life. Everybody is welcome.
Do you think if someone on a spiritual path, who doesn't have, who may not seem to have, I wouldn't say doesn't have, who may not seem to have any real life problems with family, meaning like they're detached from families in childhood, they are like monk or like, a sannyasi, let's say, young sannyasi, not the traditional sannyasi. might have any benefit from getting it done, like a past life regression, or you don't recommend? What's
I
your
can't say benefit. I'd say that you need to explore. Yeah, you're a monk today. Were you always a monk? Have you always lived lives as monks? No, definitely not. So I think when monks come, like I have a lot of Jain munis who come to see me, and priests sometimes, then they want to know why they chose a life of a muni or a priest or a monk. They're keen to know because somewhere they feel that there must be something. So that desire or the need that there must be something, that thought is still there.
yes.
So because that thought is still there, it is a good thing to explore. There are many sannyasis who don't, they are beyond this, right? They have in their meditation experienced past lives already.
Yes.
So they don't need to come for something like this. So I think experience and exploration is a great way, and past life therapy can help you to do that.
Yes, thank you. Oh yes, another question which was for old people. Now they have already lived their life, probably 70s, 80s. Do they also come to you? And if they do, for that age group, what do you see as, how do you see it will help? Yes.
So my oldest client was 85, I think 84, 85, woman in Bangalore who came to see me. And I asked her, why do you want to come in? Why do you want to do a session? And she just told me that she had some physical ailment, and she said, I don't want to die with this physical ailment. I just want to let it go. I said, yeah, okay, that would be good for you to come. So I think senior people and super seniors, first of all, they need to get rid of the fear of death. I think that's primary because they are going to transition into another dimension soon, which will not have a body. So I think letting go of the body, that fear that is there in senior citizens, I think it can be really helped through past life regression therapy. And also any ailment that they may be having and they may be dying of it, like a terminal illness, then I think it's best that they do a session so that they can just understand, first of all, why they have this illness. And then in the session, they can release that, whatever trauma that they're feeling. And they can transition later on in a much better place.
That's very good. And this question comes to me like everything has to evolve with time. Our traditional techniques, even yoga, meditation, everything, with time, because we have become different. Um, 20 years from now, we can't even imagine what kind of mind will be there existing. So, do you think, or you have experience in your career that you have had to change the way how you approach the whole thing with clients? Like, have you seen the change in how the clients are becoming different and how they will be, and what changes you think will need to be done in this whole process of past life regression?
I think initially when I started teaching and even taking clients, is what it was more structured. Like people used to have more structured minds, like one step, second step, third step, like stepwise. Then slowly over the time, I realized that people's speed of thinking is changing. They're able to absorb faster. And they ask questions also which are a little different than maybe people used to ask before. Like they want to know more about consciousness, they want to know more about the spirit, they want to understand what parallel realities are and whether they have lived in other planets before, have they always been a human. So many interesting questions started coming, right? And then I thought that I need to change the structure. It need not be structured. See, initially there was a time when people were seeing only kind of presentations, PPTs and lectures and stuff like that, and less practical and more theoretical because that's how the mind was. But today, like I hardly use PPT,
Yes.
yeah, because I think they need to experience more through all their five senses, not only audio and visual. Yeah.
Yeah.
So I think kinesthetic is a great way of moving, sensing things, developing their intuition, making them draw and color and paint and exploring both the hemispheres.
Yes.
I think we've been so traditionally uh, left hemispheric. That's one of the reasons that even questions like this come up, whether there are past lives.
Yes.
But I think we become more right hemispheric, where the visual cortex can be worked upon and the parietal areas can increase their potential. I think this question will not be there. So exploring through other mediums, whether it's movement, whether it's art, whether it's just making up things like stories, because like you said, that people have the idea that maybe it's all imagination,
Yes.
you know. So yeah, make up stories and you realize that, my God, how did I make up this story?
Yeah.
So I think things are changing. Even in past life therapy, I use a lot of other modalities. I hardly use PPT presentations. I want people to move. I want people to just experience others in the group, like scan and do things like that. And yeah, things are changing. As a teacher, you evolve, and that's only because students who come are actually evolved.
Right. That's something happens in every field, like including medicine, which I am, and I'm seeing that in spiritual field as well. That people get stuck to old, where times already changed, and most of the time it's only 10% who become someone not accepted by the general community of that. So that's why I wanted to ask, since I see that you're so passionate about what you do, like if you have seen this and how you've changed. So using body more and all the five senses to integrate in the process.
Yeah.
Thank you. I have seen that the amount of sensory input it comes, it's a child is not able to. Obviously, we haven't evolved that much, but now that outside has changed already, and so it seems like lots of diseases are coming. And most of the time, if the child is taught to suppress them, it gets suppressed actually. And in the West, it's very easy because the culture has been of suppression. So when we find Western clients, they start to let it out very easily. So is that something that's to come now, that more and more clients will come who have like lots of things suppressed from this lifetime that needs to be somehow taken out first before they get into deeper?
So, because I'm a past life regression therapist and I believe in rebirth, I can say that we have suppressed memories across lifetimes, across various civilizations that we have lived. And we have all lived during revolts and wars and battles, and we faced issues of abandonment and sickness, right? So these memories are so deep. Sometimes the client may be crying for an hour. Is the client crying about the memory in the current life? No. He's releasing those emotions which are suppressed across lifetimes. So, as a facilitator, you have to also understand that if the client is crying for an hour, don't feel that he has only this much problem. Why is he crying so much? But he's crying because think of the suppression that he may have faced across lifetimes, right? Then it will make sense to you. And according to me, catharsis is very important, okay? Because unless you release, and everybody's suppression is variable. Some people, even a small problem can trigger a huge catharsis. But catharsis in my work, I feel, is very important in any work for that matter. Like when you do surgery, what is it? It's like catharsis. You're opening the body, you're doing surgery, there's blood loss. That blood may be having certain emotions which are actually moving out. There's catharsis all the time. Even happiness is like a catharsis. And people laugh, 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 and they can't stop laughing.
Yeah.
What's that? That's also catharsis. Way of letting go, letting it out.
So one last question, I wouldn't take much time. So I'm thinking of, hopefully existence will give me that strength to have to start a regression therapy in the West. and it's going to be a completely different. We had a big group here. I can relate to it. Born in Nepal, how the Indian culture is and everything. Um, what message? What message? Let's say what motivation. What words do you have for me? What challenges will I have? And what do you want to say to me to how to go ahead with this?
Sort of, I can only say to you, as I've been seeing you for the last 7 days, that you have a natural flair to help first, and you have a natural flair to absorb because you have a great power of listening. Like I've been watching you listening more and asking less. So it means you're absorbing, right? A lot more. And you have had a life where you have been on this path, of meditation, of seeking, of knowing more about yourself. So if you want to know more about yourself, you want your clients to also know more about themselves. And I think that's the starting point. When what you have received, you want to give, and that makes you a great therapist.
To have this sense of helping, doesn't matter whether you succeed or not, because this is the beginning, and I'm jumping directly from a culture which I grew up from to a culture. Until now it was just working outside in the hospital. There is an objective, it's not, you can treat someone medically from far, you don't have to, but this is getting more closer. Like you said, when you're regressing someone, there is a possibility you yourself will be also regressing together.
Correct.
So I feel like it's a little more intimate now going into that realm. So I was, but who knows? Maybe I have a Western background as well. We only think of this life, and I say, how can I treat Western people into this? But maybe that will come by itself.
There's nothing like east or west, nothing like north or south. We're all same people, same flesh and blood, same spirit. And the most important thing, medicine is limited, sort of, as you know. You have blood test and MRI, stethoscope, and all these tools, right? And through the tools, you're trying to investigate the client's problem. Here, there are no tools. And when you don't have any tools, no, then you use your mind, actually. And you use your mind, you use your hands in a way that is different. You use your intuition, your sense, five senses differently. And that expands the facilitator's consciousness first. Because now you have to challenge yourself, right? So when you start challenging yourself, um, imagine what can happen. You know, it's like people thought that how can you ever go to the moon? But they challenged. They had a rocket, but they had to challenge their mind to go to the moon. And this is exactly like that. You challenge your mind, and then you jump over the mind, and then everything changes for you. I'm sure with your medical background, and now with your interest in the mind rather than the body, you will see a huge shift in your work, even as a doctor. I've seen my friends who are doctors who've done past life therapy and trained as past life regression therapists. They're different people today. So you too, my dear, are going to be an asset.
Thank you. So thank you very much, ma'am, for coming and sharing these insights. I hope this will be helpful for many people who are in this path and having confusion about it. Thank you so much.
Thank you, sir. All the best.